Certainly. Here's a deep dive into bipolar disorder, covering its classification, symptoms, causes, diagnosis, treatment options, and ongoing research. Bipolar disorder is classified into several types, reflecting the nature and severity of mood episodes. Bipolar 1 disorder, manic episodes. At least one manic episode is required for diagnosis. Manic episodes can be severe and may lead to hospitalization. Depressive episodes. Major depressive episodes are common but not required for diagnosis. Bipolar 2 disorder, hypomanic episodes, characterized by less severe manic symptoms that do not lead to significant impairment in functioning. Major depressive episodes. At least one major depressive episode is required for diagnosis. Cyclothymic disorder involves numerous periods of hypomanic symptoms and depressive symptoms over at least 2 years, or 1 year in children and adolescents. Symptoms do not meet the full criteria for a hypomanic or major depressive episode. Other specified and unspecified bipolar and related disorders. These categories include symptoms that do not fit the criteria for the other types, but still involve significant mood disturbances. Symptoms of a manic episode can be quite varied, but often include the following: mood changes, such as an abnormally elevated, expansive, or irritable mood. Behavioral changes might involve engaging in high-risk activities like spending sprees or sexual indiscretions. Cognitive symptoms can include racing thoughts, being easily distracted, and having an inflated self-esteem or grandiosity. And physically, you might notice increased energy and a reduced need for sleep. Hypomanic episodes share similarities with manic episodes, but are less severe and shorter in duration, typically lasting at least 4 consecutive days. Now let's talk about depressive episode symptoms. These often include persistent feelings of sadness, hopelessness, or emptiness. In terms of behavior, there might be withdrawal from social activities and a decreased interest in previously enjoyed activities. Cognitive symptoms can manifest as difficulty concentrating, indecisiveness, and negative thoughts. Physically, you might see changes in appetite, sleep disturbances, fatigue, or a loss of energy. When it comes to causes and risk factors, genetic factors play a significant role. A family history of bipolar disorder increases the risk, suggesting a genetic predisposition. Research indicates that certain genes may be involved. Neurobiological factors are also important. Neuroimaging studies have shown differences in the size and function of certain brain regions, like the amygdala and prefrontal cortex, in individuals with bipolar disorder. Imbalances in neurotransmitters such as serotonin, dopamine, and norepinephrine are thought to play a critical role as well. Environmental factors such as stressful life events can play a significant role in triggering mood episodes. Major life changes like the loss of a loved one or divorce, as well as chronic stress, can be particularly impactful. Substance abuse, including alcohol or drug misuse, can also exacerbate symptoms and complicate treatment. When it comes to diagnosis, clinical assessment is key. This typically involves detailed interviews about mood changes, their duration, and their impact on daily life. The DSM-5, or Diagnostic and Statistical Manual of Mental Disorders, provides specific criteria for diagnosing bipolar disorder. Additionally, patients may be asked to keep a mood diary to track episodes over time. It's crucial to differentiate bipolar disorder from other mood disorders, such as major depressive disorder and borderline personality disorder, as well as from medical conditions like thyroid disorders. Effective management of bipolar disorder often involves a combination of medication, psychotherapy, and lifestyle changes. When it comes to medications, mood stabilizers and antipsychotics are commonly used. Mood stabilizers like lithium are often considered the gold standard, effective for managing both manic and depressive episodes. Valproate is another option, particularly used for rapid cycling and mixed episodes. Antipsychotics, specifically second-generation antipsychotics like quetiapine and olanzapine, are often prescribed for acute mania and maintenance therapy. Antidepressants, caution is advised, as they can trigger manic episodes if not used with a mood stabilizer. Anticonvulsants. Medications like lamotrigine can be effective in stabilizing mood. Psychotherapy, cognitive behavioral therapy, or CBT, helps individuals identify and change negative thought patterns and behaviors associated with mood episodes. Interpersonal and social rhythm therapy, also known as IPSRT, focuses on stabilizing daily rhythms like sleep and activity and improving interpersonal relationships. Family-focused therapy involves family members in treatment to improve communication and support. Lifestyle changes. Establishing a regular sleep schedule and daily routine can help stabilize mood. Exercise, regular physical activity can reduce symptoms of depression and anxiety. Diet. A balanced diet supports overall mental health. Stress management techniques such as mindfulness, meditation, and yoga can help reduce stress. Ongoing research in bipolar disorder is ongoing and focuses on several areas. Genetics, identifying specific genes associated with bipolar disorder to understand its biological basis. Neuroimaging, exploring brain activity and structure differences to improve diagnostic accuracy and treatment approaches. New medications, developing and testing novel pharmacological treatments that are more effective and have fewer side effects. Psychotherapy, investigating the efficacy of various therapeutic approaches and their integration with medication. Bipolar disorder is a complex and multifaceted mental health condition that requires a comprehensive approach for effective management. With the right combination of medication, therapy, and lifestyle adjustments, individuals with bipolar disorder can lead fulfilling lives. Early diagnosis and intervention are crucial, and ongoing support from healthcare providers, family, and support groups can significantly enhance the quality of life for those affected by this disorder. If you suspect that you or someone you know may have bipolar disorder, it's essential to seek professional help.